What I would like to do this afternoon is making a bit of a point and ask basically a question. If we as health workers are not increasingly, I would say, being used for other purposes than health. And that in itself may not be so bad, but I do feel that if this indeed does take place, if we do not lack the kind of framework to analyze this, if this is something we can live with as an individual or as a group where we belong to or not. Let me try to build up that argument and also explain throughout why I have chosen this title. But I will start with two small stories. This, you may remember this picture. I think it's a quite famous picture. You have seen later ones, but this is from the road to Goma. Later on, there was pictures they all came back a couple of years later. But this were essentially the Hutus fleeing Rwanda. That was the time that, of course, during the genocide, it was mainly the Hutu populations which were the genocidaires, the ones who were committing the genocide, and then the Tutsi rebels from southern Uganda, they came in and they captured the country, and up to today they are in charge. Of course, the Hutus, they were fearing, okay, now there will be retaliation, so let's leave the country. So they went up to, you see the mountains in the distance, that's Goma, that's Zaire, as it was called those days, the Democratic Republic of the Congo. And that's where, of course, they ended up at refugee camps or alongside the border, just across the border. There was no water, there was no nothing, and it soon emerged. Of course, there was quite a big response of the international community because they could not do anything in Rwanda. There was a lot of feelings of guilt, but at least here was a big population, obviously in need, and there was this huge Shigella outbreak, which you see on our televisions, people being, and they couldn't even be buried because there was all volcanic grounds, which just makes it very difficult to get water, but even to bury the death. So a big response. After a few months, you had all those different refugee camps with thousands, not tens, 100,000 people along the border. It was realized that this international response in helping these people, most of them, of course, being completely innocent to the genocide. They were not the real perpetrators, but they were part of that same ethnic group. But among them, there were the real genocidaires, the ones who did do. And they tried to, and they used those camps to regroup themselves. They could use the food and the other resources to get stronger, and then with the idea of, okay, we try to fight back. That led to a lot of soul-searching and dilemmas for almost all the humanitarian workers in those areas. There was big debates. Should we stay and help those people who obviously do need help? If we go away, they will suffer. Or should we leave because we are staying, we will help those ones who were so bad to do more bad, basically. A lot of debate, and I'll see what they used for the debate in a moment's time, but just give you the end result, which was a bit of a compromise. Some agencies left and others were staying. Even within agencies, for instance, the story goes there was one MSF section left and the other MSF section stayed. So there was, at that level, a bit of a compromise. But it was a heavy debate, difficult decision for the people who had to make those decisions. Another story, more recent. It seems quite appropriate to have it in this building because some people told me that this building was erected because of the cholera here in Denmark. Can you still imagine? Difficult. But cholera outbreaks do occur, and they seem to occur at worst in countries which are not governed so bad, where there is some collapse of health services and so on and so on. So almost a bit over a year ago, there was this big cholera outbreak in Zimbabwe. And it got kind of out of hand, and there was quite a bit of an influx at one stage of international aid. Of course, in the context of this problematic government led by Mugabe in this country. At one stage, a quite peculiar story emerged. Of course, they were treating people, and so that's kind of things which you have to do, but you want to do something for prevention. So there was the option to give chemicals to treat the water for the population in the towns. So there was a group who wanted to buy these chemicals and give them to the ones who could do that, which would mean a parastatal, so a government body who was in charge of the water plants in that city. Seems like a good idea from a health perspective. You treat water so you prevent more cholera to happen. But there was quite some opposition to that particular group, in particular among donors. They said, no, we are not going to do that, we are not going to fund it, because by doing so, we are propping up the government. Because they look better, they seem to be doing something, and that we can't do this because it's bad government. I would imagine that most of you, when confronted with this kind of dilemma, you would probably support the group who want to do that. I think you are having this medical efforts. You probably take the perspective, no, helping people would go first to this other effect, but maybe we are supporting the government. But you can see the kind of dilemmas where sometimes you get into in health, which you can withhold it from some people, which is obviously a political act. But I think also in other circumstances you give something to some groups, which makes you feel better, but you're part of the same, you do it partly out of political considerations. The humanitarian principles, you're probably familiar with them, very much coming from the Red Cross movement, way back in the times of Henri Dunant in the 19th century, a development of humanitarian principles which are kind of guidelines. It's guiding humanitarian organizations how they can behave and what they can uphold to try to give assistance in populations in need. And these are the 4 principles which most humanitarian agencies sign up to. They sign up to some additional ones, but these are always the 4 key ones. And humanity is always the number one. So we help people irrespective of anything. That comes first. And impartiality, we do it in proportion to need. And then the 2 other ones are more in support of that. We want to remain neutral and we want to be independent. In the reality of humanitarian work, very difficult to uphold these. And in particular, if there are this crisis situation, you can imagine people discussing this case of around Rwanda. It's exactly this okay, humanity, okay, we have to stay. But we breach neutrality by supporting one group, one war party in a way. So very difficult discussion. But at least it is a bit of a framework in which this can be discussed and it's used. And there's a range of other examples where they use this as a framework to think things through and then come to a decision, an operational decision.